everyone, Jennifer here, and welcome to another segment of Ask the Doctor. We are back in our favorite plastic surgeon's office, Dr. Aviva Preminger, and today we're talking about something that's been popping up a lot lately, kind of a serious subject, and that's breast augmentation and then the follow-up procedure that happens afterwards. Today's patient is our very own Editor-in-Chief Vanessa Coppes, and it has been 14 years since she had her very own breast augmentation. We realize there's a lot of concerns with follow-up, when to replace, how to replace. So today we're talking to the absolute best, and that's Dr. Preminger. Stay tuned and let's take a look at what she has to say.
Oh my God, I'm so excited to be here. I am excited, but at the same time, genuinely freaked out. So I am looking forward to everything that you have to share, because I know I've had several conversations with friends that have had breast augmentations in the past. It's been 14 years since I got mine done.
Okay.
So it's time.
Okay.
To swap them out. I actually am here mostly because a very close friend of mine, her mother became ill with a rare form of cancer, and apparently it was tracked down to her breast implants. So Can you tell us if that has anything to do with that? Just take it away, because I...
Okay. Absolutely.
Yeah.
So let's just go through a couple things. So you had these breast implants placed in 2006. Were they placed in the United States?
They were placed in the Dominican Republic.
Okay. And what do you know about the implants? Do you know what size they are? Did they give you a card with the information?
Nope.
Nothing.
I know that they are a mix of silicone and collagen. That's what I know.
So there's no such thing as silicone and collagen,
Okay.
but maybe silicone and saline, a combination? I don't know.
Okay. But again, we're talking about the Dominican Republic 14 years ago, so honestly...
You have no idea.
I don't know.
So let's back up a little bit to your
Sure.
friend and what might have happened with your friend and kind of the state and technology of breast implants currently.
Yes.
Okay? So you've had implants in for like 14 years. I'm
14
going to
years.
examine you. I'm going to see kind of, what those implants look like. Your last mammogram was in 2018.
Yes.
So you're due for one.
Okay.
So before we do anything, we're not going to say any ages on camera, but but you should be getting a screening mammogram once a year.
Perfect.
Okay. So
which I knew, however, because I have implants, I know that there's always a caveat with that, right? When you go in, they make you sign because...
Okay, so if you're going to an established radiology place that does mammography in New York, there are so many women with breast implants in this city.
I would imagine,
It's really not something you have to worry about. And the last thing we ever want someone doing is putting off a mammogram because they're worried that it's going to damage their breast implants.
And that's why I wanted to bring that up, because I know that that's something that is of concern. I know mammograms in general are a concern for women because of the pain. Does it hurt? I've done them with my implants, and they are painless, and they are necessary. But now we know every year.
100%. And before we go ahead and do any breast surgery, I usually say that anytime I have a patient who's over 35, we want to get a baseline mammogram. And so I said over 35. We want to get a baseline mammogram, basically. And then we want to make sure that, at a certain point we're getting annual mammograms. Okay, so anyone over 40 should be getting an annual mammogram, and breast implants should definitely not be a deterrent to that. Any decent mammographer will be doing something called Eklund views, which are special views of the breast with the breast implant in place to be able to evaluate it. If they need any additional imaging, such as an ultrasound or an MRI, the radiologist will be able to set you up for that. So absolutely, before we go ahead and do anything, we want to evaluate your breast tissue. We want to make sure you're not having any breast issues. And while the mammogram might not tell us if the implant is intact, I'll be able to have a sense by examining you, and then if we have any questions when they do the mammogram, we can also get an ultrasound or an MRI to help with that information.
Perfect.
Any family history of breast cancer here?
I have an aunt.
Okay, on your mom
on
or your
my
dad's
father's side.
Okay.
My father died of cancer.
Okay.
There's a lot of cancer in my family. So on my dad's side, about 5 or 6 cases. My brother was diagnosed 2 years ago with salivary gland cancer and skin cancer. And as of right now, I'm in the clear, but always there's a concern in the back of my mind. Yes.
And your aunt who had breast cancer, did she pass away from it?
Yes, she did.
And how old was she when she was diagnosed?
She was late 40s.
So she was young.
Yeah. My grandmother also, on my dad's side, passed away from uterine cancer. Yes.
Okay. Okay, so we definitely want to make sure that we get a mammogram
Yes.
before we go ahead with anything. You are done having children, I am assuming?
Yes.
Okay. And you breastfed?
I did both.
Okay.
Yes.
All right. And no other major medical problems here that I see?
The only thing, and I mean, because I know you asked about hemorrhaging and bleeding and whatnot, my periods are very, very heavy.
Okay.
But that's the only other
So
concern
what
I
we'll
have.
do before we go ahead with any surgery is we'll get medical clearance
Okay.
and we'll get basic blood work and we'll make sure you're not anemic from that.
Okay.
Do you take iron or vitamin
Every
C
day.
or anything?
I do.
Oh,
take,
good.
Yes, I take iron every day. I forgot to.
And do you take vitamin C also?
Yes, I do.
Okay, good.
Yeah.
Good. And are you allergic to anything?
I'm not.
Good. All right. And you don't smoke.
I do not anymore.
Good. Hooray. Smoking is a big no-no.
Yeah.
Okay. All right. Perfect.
Mhm.
So let me tell you a little bit about how this is going to work, what we're going to do.
Mhm.
I'm going to examine you.
Okay.
Okay. We'll have you back to the camera so that way only I can see and you can see, you know, the measurements we're taking. I'm going to call out some measurements to Alana here so that we have a sense of, you know, of what your measurements are and I can get a sense of, you know, what we're looking to do. Are you happy with the current size of your breasts?
No. I think
Okay.
that with time they have grown a little bit
Okay.
more than I would like them to be. It's actually become a challenge to when I buy clothes. Like I know that I'm smaller, you know, like I can't fit into a medium anymore, which I used to be able to, especially before kids. So it's tight always because of my breasts.
Because of your chest. A lot of women have that complaint when their breasts are too large,
Yeah.
which is that what ends up happening is you can't buy a shirt
No.
that's going to accentuate your waist
Correct.
because then it's too tight on
It's
top.
and I either have to get things taken in. It's like a whole to do. Also, what I've noticed, and I knew this before I had implants, that I always had, and I think we all do have one breast larger than the other.
Yeah, they're sisters, not twins. I generally say.
Yeah, but like you'll see, like
Okay.
it is obvious.
Which one? The left?
The
is
left,
bigger?
yes.
Most, that's pretty common.
Okay.
Pretty
But for the most part, I mean, they've maintained their shape, and you know, I've never had any issues other than right now. It just feels like they're in my way
Got it.
a little bit. So
You don't want them in your way.
No, and I do yoga. So when, you know, I was even telling Jennifer the other day, like when I was in a position, like I'm like, oh my god, like I can't,
I can't do it.
I can't do it because they're there.
They're literally getting in the way. Okay.
Yeah.
I also just want to have a conversation about what you were talking about with your friend. And I think it's an important conversation to
100%.
be had.
Yes.
And I want to make sure that
Well,
our
and-
readers and viewers actually hear
And I
this
want you to
conversation.
really explain the importance of swapping out implants because I think that's, you know, I've completely let it go because I haven't had any issues. However, that's not the right thing to do either. So please go into that a little
100%.
bit. Yeah.
So the first thing we should talk about is that what I tell my patients when they come in for breast augmentation is that it's not a one and done procedure.
Okay.
So what I usually say is it's a little bit like buying a car. You're going to enjoy it.
Yes.
It is going to get you where you want to go.
Yep.
But eventually it's going to break down and need some maintenance. And so what we want to do is we want to make sure
I'm there.
we want to make sure that we're following.
Yeah.
Okay? And I actually say to my patients, come back every year to see me for an examination. I want to see you. I'm not charging you for that follow-up consultation. I want to be able to see you and make sure that everything's okay and put my hands on the implants, make sure they're still intact and you're not having any problems with them and that we stay in touch. You know, it's really, really, really important. I think a lot of people are of the mindset that they get their breast implants done and they're happy with them and they're never going back. You know, people get them done in their 20s and it's like, oh, these are fantastic, and that's the end of it.
Exactly.
I think it's actually really important that people know to follow up once a year, and then, you know, when they get to a certain point that they're getting their annual mammograms and everything like that.
Okay.
As far as the integrity of the implants are concerned, what I usually say to patients is that on average they last about 10 years. What does that mean? Does that mean that at 10 years you need to run in here and say, take them out?
Yeah.
You know, not necessarily,
Yeah.
okay? If the implants are intact and everything looks fine, there's no reason to necessarily switch them out at 10 years. That said, when you start to get to that 15-year point, in a lot of cases, they either need a little bit of maintenance, people have like changed their minds, they start to things start to sag over the implants, or the integrity of the implants starts to be affected in some way.
Okay.
And so when you get to that point, I think it's really important that, particularly around the 10-year mark, that you start seeing someone and kind of having this in mind and asking questions, okay? The types of implants that we've had available have changed over the years. You had implants put in 14 years ago. You had implants put in outside the United States, where the rules are also a little bit different. So one of the important conversations to be had is, and everybody who's thinking of getting implants should kind of keep this in mind, it's actually really important to know what's inside your body.
Yes.
So if you're getting a breast augmentation done, the surgeon should give you a card after that procedure.
Which I'm not even gonna, like, I'm right now sitting here like, oh my God, like I just wanted
no
bigger
idea.
boobs, and I just ran with that, you know?
That was it.
Yeah.
You know, you're young, you're like, great, these look fantastic, I'm done.
Yes.
But it's actually really important that they give you a card that has the implant manufacturer, the type of implant you have in, and the size of the implant. Okay?
Yeah.
Because it's very important if there's any kind of a product recall, if there's a warranty issue, or even if you're just coming in 15 years later saying, well, I want smaller, and I'm sort of scratching my head figuring out, well, what exactly do you have in there now? Because I need to figure that out to figure out the replacement. Okay,
Yeah.
so very, very important for everyone to know. As far as the cancer that you're probably talking about, we have different types of implants that are available. Okay, we have saline implants, and I'm going to show you that. Hold on, I'm just going to pass this back to you. So this is a saline implant, and a saline implant is basically an empty bag that gets filled with saline, or sterile saline, or salt water. Okay. For a while, this was all that was actually available for placement in the United States. Okay, that changed in 2006 when we started to have silicone implants back on the market. So these are great devices still. The disadvantage to these is that they just don't feel as natural as silicone implants. This is a silicone implant,
Which I probably,
it's a cohesive gel.
Which I honestly think this is what I have. I just, from the conversation I remember, he mentioning collagen. I don't know if that was like a thing.
It's hard, it's hard to say, and it's hard to say what might have been available outside of the United States. The breast implant associated lymphoma, which I imagine is what you are talking about that your friend may have had, is largely associated with a textured device. Do you have one of the textured devices in here, Alana?
I do not.
I'm gonna have Alana go get one of those so you can actually see what that is. And that is actually the device that's associated with this breast implant associated lymphoma.
You can
you can see it, you can feel it. These were very commonly used.
I was just gonna ask, like, why would someone?
Why would you use a textured device?
Correct.
So the advantage to using a textured device, and the reason surgeons liked using a textured device, so for example, this is a teardrop implant.
Got it.
So the shaped or teardrop implants, the texturing is almost like a grip.
Okay.
It doesn't allow the implant to slide around so much. Okay? So the shaped implants had to be textured. There were also round implants that were textured, and those were very commonly used, in fact, preferentially used outside of the United States, so in Europe and everything. They haven't actually been taken off the market everywhere, but for patients who do have textured implants in their bodies, it's a good idea just to be aware of it for screening purposes. There's no current recommendations to take them all out, but I do think that if you have them in place, it's something that you should just be a little more aware of. I've also had patients come in who've had implants placed, particularly outside the United States, like the Profil implants that were recalled, actually, and it's very important to know all of that. Some of those were actually made with industrial silicone instead of medical grade silicone. So, you're at that 14-year mark. You're looking to have something smaller anyway. And so let's take some measurements and see, and we'll go from there. Let's look at some gloves, actually. You have a fair amount of breast tissue of your own. You really do.
Is that a good thing?
It's a good thing to have that shape and lift, and even if I need to take out a little bit of volume to correct the symmetry, I think that that's something we could do. So we go a little bit smaller and a little bit of a lift, and I would also make your area was a little bit smaller at the same time, which most women like, actually. it kind of reduces and lifts everything. Okay. So what I want to have a seat. So what incision did they use to put the implants in?
Underneath
the areola?
Underneath my areola.
It healed up really nicely.
Yeah. I do have, I honestly don't think the doctor did wrong by me. I just think
I don't think they did at all. You actually have a nice result.
Yeah, and I do too, and I've never had any issues. However, you know, we are at the 14-year mark, and it's time.
I think it's
definitely time, and
idea.
I also don't want to worry about this in another 10 years. Like, I don't want to be like, okay, now I gotta go.
It's also kind of a bigger mess once you go in if something's ruptured or anything like that, and you're looking to downsize anyway. So I think it's a reasonable time. I think it's a reasonable time to do it. I'll just make a note that she has infraareolar scars and a little bit of a contracture on the right side. If you feel that it's like a little bit firm there, so it's a little bit of scarring around that implant.
I know that I had probably about 6 months after, I could feel
a little bit of
something.
On that side. I can definitely feel bigger.
Yeah.
But this is removing about 300 cc's. That would probably be removing the full volume of what you have in.
Okay.
And I'm curious to see, like, what do you like?
I mean, I definitely have always felt like they look very natural. So that, I mean, keeping that look obviously is important. But that's, I mean, that looks good. I like that.
Going down about 100 cc's.
Yeah.
Kind of a thing.
Yeah.
That's down about 100, but we still have to do the lift. This will give you an idea of what the lift looks like. I mean, the scars are worse from this than they are from the actual lift, but it gives you an idea of where we'd be placing the incisions.
Got it.
And I would actually place an incision underneath the breastbone to remove the implant, because that way, if there's any capsule around it, it actually gives me the exposure to be able to, you know, remove everything. That needs to be removed at the same time, particularly if what you have is a textured device in. So, you know, and then it's a little bit of a guessing game to figure out what size implant you have currently, because you have no
from what I
sense of it.
remember is a C cup, which I
know. So it goes by cc's. So they would have told you a volume, like 300 cc's,
He
400
didn't tell me
cc's.
volumes. He just said
No idea.
I went from a double A, which is what I was, to a C.
Got it. Oh, they just saved that. I'm going to screenshot it. So what I would say is this. What I usually do in these kind of situations, because I do a lot of revision breast surgery, is that I guess what you have and what I think we're going to try to do. And I order a number of different sizes actually to have available in the operating room that day. I remove the implants that you have in. I take a look at them. It gives me a sense of, you know, okay, this is the volume she had and she wants to go smaller. And then I have a whole collection of implants to choose from to actually put in and see what looks nice on you. And I will often use something called a sizer, which is not a permanent implant. It's a temporary device. I put it in. I sit you up. And I see if it's kind of in line with the look you were going for.
Awesome.
Okay. Yeah. What questions do you have?
I mean, honestly, next steps would be obviously go and get a mammogram.
100%.
And then once we get the results from that, then go from there. I mean, mainly my questions you answered all of them, which was my concern about timing and breast health. More importantly, obviously there is that fear just because there's so much cancer in my family. There's always kind of like looming, oh my God. And also trying to demystify a little bit of what all of this looks like for women, because I think that the fear often stops us from doing what's really best for our health. And while I went into a breast augmentation for a self-esteem type of situation, now I feel like I'm in a bit of a health pickle, and I'm trying to obviously maintain, you know, a look, because I of course want, you know, breasts to look good, but I definitely want to be healthy. So you have been incredibly, I mean, your knowledge is like unbelievable. Thank you so much for answering and just going really into all of this, because I can't begin to tell you how many people reached out to me. Ask her this. Make sure that you.
Well, I want to make sure I cover everything today.
And I had no idea about textured implants. Like, I had no idea. And even I think my advice would be for anyone who's even considering a breast augmentation, ask a lot of questions. Come to someone who knows what they're doing. I never even knew the different types, the sizing. I'm sitting here with you today, an informed individual, or so I thought, but I have no idea what's in my body right now. So
yeah, and so I think that's why it's so important.
Yes.
That people who are either considering getting this done for the first time or people who have actual implants in place and kind of don't know what the next steps are or what they should be thinking about, are just aware of the whole process. So if it's someone who's thinking about getting breast implants to begin with, that they understand what their different options are and how the sizing works. And usually what we do the first time somebody comes in for a breast augmentation is we actually use two modalities together, which is the 3D imaging plus a sizing bra with the implants. Yeah. But we don't need to use that in you because you have implants already.
Correct.
And then we want to make sure that after they've had their procedure, they know actually what's inside their bodies, right? Yeah. That they walk away with that card or at least the information so they know going forward.
Yeah.
And then once someone does have implants, even if they don't know what's in place, that they're aware of just general breast health and getting breast exams and following up, annually with a physician and making sure to get their mammograms and not being afraid to get a mammogram because they're afraid they're going to damage the implants. That's the last thing we want anyone to do.
Yeah.
And then just being aware at some point that they will need some maintenance and that's okay, and that we can safely go ahead and and revise and remove and kind of just tweak and update things a little bit to kind of keep you looking your best and the way you wanted to look when you kind of signed up for this to begin with.
Amen to that. I mean, if anyone else wants to find any more information, where should we reach out to you?
So they can always call my office, 212-706-1900. They can look at my website to see what my results look like. I do a lot of breast surgery, so it's PremingerMD.com. And they can also follow me on Instagram at PremingerMD.